Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, Alzheimer's is a type of dementia that affects memory, thinking and behavior. Symptoms eventually grow severe enough to interfere with daily tasks. So, to discuss on this, we have with us today Dr. Dipesh Bhagabati, former professor of psychiatrist at Guwahati Medical College. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show. So today the topic which we have taken is dementia and plus Alzheimer. Now, at first, there will be a lot of confusion in everybody's mind. Is dementia and Alzheimer same thing, or is there a difference between the two terms? What exactly it is, Doctor?
You're very right. It is the first question that people have in their mind.
Yeah.
And whether they are, interchanging. So dementia is a global term.
Okay.
Dementia is a global term which signifies a progressive memory loss. And then subsequently, the behavioral problems and thinking problems and judgment, difficulty in making judgment, and these things come about. Now, there is a global term for loss of memory deficit, which is progressive. Now, this dementia, loss of progressive memory, can occur on various occasions, and various factors might lead to that kind of problem. Okay. Now, one of the factors that lead to this kind of problems, memory deficit, is the Alzheimer's.
Okay. One of the factors.
One of the factors. So, there are other kinds of dementia like, what we call a multi-infect dementia, which occurs because of some mild strokes in the brain. There is something called normal pressure hydrocephalus dementia, which occurs because of excessive fluid accumulation in the brain. So, there are different kinds of dementia. So, Alzheimer's, we talk more of Alzheimer's. So, we hear the name Alzheimer's more because it is the commonest of the dementias.
It's very common.
Very common in terms of 50% of all dementias, 50 to 60% of all dementias will be because of Alzheimer's. Now, what is Alzheimer's then in that case?
Yeah.
The Alzheimer's has been, the name has been given by an individual called Loy Alzheimer's in Germany.
Okay.
He found that people who progressively lose memory in their old age, above the age of 65 or so, when their brain is examined, earlier days it was in a post-mortem examination of the brain, they found that certain abnormal depositions occurred in the brain.
Okay.
And now we know that these abnormal depositions, which occur in case of Alzheimer's, are some kind of a protein deficit.
Protein deficiency.
Some kind of protein deposits.
Okay.
Some kind of abnormal protein get deposited, and then they harden the brain surface. So, brain surface is very soft, there is a hardening of brain surface. So, what happens when the hardening of the brain surface, the normal brain tissues which keep our memory, thinking, these are brain functions, judgment, emotions, there's factors are affected. These functions of our system, our cognitive functions, our memory, our emotional factors, our behavior, all these functions are affected.
Okay.
And what happens, this abnormal protein deposition, it goes on and on and on. So, there is a progressive declining in memory.
Okay.
And progressively we find this memory loss. So, that is why it is known as Alzheimer's. These are called Alzheimer's plaques.
Plaques.
Plaques, Alzheimer's plaques.
Okay.
These abnormal protein deposits are called abnormal plaques. That is the difference between dementia and Alzheimer's. So, Alzheimer's is one type of dementia.
One type of
dementia. And this is the commonest type of dementia that occurs in human beings.
Okay.
So, that is why you have to know about it.
Okay. Now, Doctor, you mentioned about Alzheimer's. So, if we want to know about the factors, is there any types of Alzheimer's, or it's common and easily seen in everybody?
Yeah. Alzheimer's, we do not sub-classify them into different types. So, Alzheimer's, when it progresses, I said it's a progressive disorder, there are actually 7 stages of dementia from the earliest stage to the late stage.
So, there are different stages.
There are different stages of dementia. So, actually there are about 7 stages of dementia. In the first phase, which usually occurs after the age of 65, if it occurs, only beyond the age of 65 to say 70, only 1 in 100 persons will suffer from Alzheimer's.
Okay.
So, there is 99% of the people will not have Alzheimer's. So, one in 100% will have Alzheimer's. As the age progresses, so there is increased severity. So, beyond 70 to 75, say you can say about 5% of people have Alzheimer's. So, 75 to 85, say about 10%, about 1 in 11, 11 in 100 So we'll have dementia, Alzheimer's dementia. And beyond 85, about 1/3 of the people are affected by this particular problem.
Okay.
So when this, the stages occur, in whatever age it occurs, the first phase is that people might be forgetful about things happening in the recent past. By recent past, I mean this last, say, 24 hours or 48 hours, what has happened.
Okay.
So for example, I have had tea, and then again I say that, no, today I haven't had tea. Nobody has given me tea, right? Or,
recent incidents.
The recent incidents. So a visitor has come to my house in the morning, and I said nobody has come in the morning. Or there is a schedule. So for example, you have invited me today for this program. I said yes in the morning. Now after a couple of hours, I totally forget, and then you asked me, "Are you coming?" I said, "Where?" So I don't remember.
Okay.
So forgetting appointments, forgetting activities.
The recent events which has happened with you. Those are the events which you forget.
These are the events that you forget, in the first phase.
Okay.
And the second phase, people forget about, where do I keep the things in a proper way. Suppose I keep my toothbrush in the after my brushing my teeth in the morning in the there's a proper place in the bathroom. Then I bring it up and I keep my toothpaste in the toothbrush in the refrigerator. So misplacing of objects which occurs frequently and repeatedly could be a feature of Alzheimer's.
Acha.
Or I go to a room in my house and then I forget what is this place. Or I go to a familiar place and all of a sudden I remember what is this place, where I have come. But if I forget that I go to a room and then try to remember why I have come to this room, that is not Alzheimer's. That is not Alzheimer's. But I do not recognize the room. Instead of going to my bedroom, I go to the toilet and look for my bed. Yeah, I go instead of going to my bed, I go to my children's bed and try to take a nap there. That is what happened subsequently.
So that is unusual things.
These are the unusual, abnormal behaviors which people might observe, family members might observe. Subsequently, the person might become irritable, suspicious. These things might happen. And at a late stage, I do not recognize people even around me.
Okay.
And when the final stage comes, I do not know even my name. I do not know who am I. So disorientation occurs. The time, the place, and the person.
Time, the place, and the person. Doctor, we'll talk on this. We'll have a detailed discussion, but we have a caller at this point in time. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব আলজাইমাৰ প্ৰিকশন আপোনাৰ প্ৰশ্নটো আৰু একবাৰ কৰিব হেল্ল হেল্ল
হেল্ল
কওকচোন আপোনাৰ প্ৰশ্নটো কৰিব All right. What I learned from the question was like the precautions necessary to take for an Alzheimer patient. So that was, you can reply him to the comfortable language. Asamizate kobo paribo.
আমি আপুনি সুধিছে আপোনাৰ প্ৰশ্নটো যে আমি বাধা কেনেকৈ দিব পাৰোঁ আৰু আলজাইমাৰ্ছ পেচেণ্ট এজন ৰোগী যে আলজাইমাৰ্ছ অলৰেডি হৈ গৈছে তেওঁক কেনেকৈ আমি ভৱিষ্যতটো বেছি হোৱালৈ আমি কেনেকৈ বাধা দিব পাৰোঁ আৰু এটা হৈছে নতুনকৈ এজন মানুহৰ হোৱাই নাই তেওঁক কেনেকৈ বাধা দিব পাৰে প্ৰথম কথা হৈছে যে আমি যেহেতু এই অসুখটো আলজাইমাৰ্ছ এই ৰোগটো 65 পিছৰ পৰা আৰম্ভ হোৱাৰ ভয়টো থাকে মই আগতে ক'লোঁ যে 100 জনৰ ভিতৰত এজনৰ হ'ব 65 পিছত বয়স বাঢ়ি গ'লে অলপ ৰিস্কটো বাঢ়ি যায় কিন্তু প্ৰথমতে হৈছে কি আপোনাৰ যেতিয়া এজন ডেকা মানুহে মোৰ ভৱিষ্যতে আলজাইমাৰ্ছ হ'ব পাৰে বুলি ভাবি পেলাই কি নোহোৱাৰ ব্যৱস্থা কৰিব পাৰে প্ৰিভেণ্টিভ মেজাৰ্ছ প্ৰথম কথা হৈছে মানুহৰ ফিজিকেল এক্টিভিটি খুব ইম্পৰ্টেণ্ট ফিজিকেল এক্টিভিটি আৰু শাৰীৰিক এনি ধৰণৰ এক্সাৰচাইজ যদি তেওঁ দৌৰা হওক খোজকঢ়া হওক বা তেওঁ ৱেইট এক্সাৰচাইজ কৰে যিকোনো শাৰীৰিক এক্সাৰচাইজ মেণ্টেল এক্সাৰচাইজটো খুব ইম্পৰ্টেণ্ট যিকোনো মানুহৰ মনটো যিমানে এক্টিভ থাকে মই আগতে যিটো কৈছোঁ যে মানুহৰ মগজুৰ যিবিলাক কোষ থাকে আলজাইমাৰ্ছত সেই কোষবিলাক লাহে লাহে ডেমেজ হ'বলৈ আৰম্ভ কৰে বেয়া হ'বলৈ আৰম্ভ কৰে কিন্তু এটা ভাল কথাটো কি যে মগজুৰ কোষবিলাক যিমান বেয়া হয় আৰু আমাৰ তেনেকৈ নতুন নতুন মগজুৰ কোষো এটা প্ৰক্ৰিয়া এটা চলি থাকে নতুন কোষ হৈ থাকে শৰীৰত কিন্তু আলজাইমাৰ্ছত কি হয় এই যে যিটো নোহোৱা হৈ যোৱাৰ যিটো প্ৰচেছ যিটো পদ্ধতি সেইটো অলপ বেছি ঘনকৈ হ'বলৈ কৰে, বেছি হ'বলৈ আৰম্ভ কৰে, আৰু নতুন কোষ হোৱাৰ যিটো প্ৰক্ৰিয়া সেইটো অলপ কম হৈ যায়। কিন্তু নতুন কোষ যিটো প্ৰক্ৰিয়া সেইটো যদি আমি কৰিবলৈ খোজোঁ তেতিয়াহ'লে যে শাৰীৰিক পৰিশ্ৰম, মানসিক পৰিশ্ৰম এই দুটাই বস্তু খুব ইম্পৰ্টেণ্ট, দুটাই খুব লাগে। আৰু তাৰ লগতে ধৰি লওক আমি কিছুমান এক্টিভিটিছ যদি কৰি থাকোঁ, নতুন বস্তু এটা শিকিবলৈ যদি আৰম্ভ কৰোঁ, সমস্যাৰ সমাধানৰ যদি চেষ্টা কৰোঁ, সেইবিলাকে আলজাইমাৰ্ছ ৰোগটো বাধা দিয়াত সহায় কৰে। তাৰ লগতে আমাৰ ধৰি লওক কিছুমান ৰোগ থাকে, ধৰি লওক হাই ব্লাড প্ৰেছাৰ, তাৰপিছত তেনেকুৱা ধৰণৰ খুব এক্সেচিভ এলকহল কনজামশ্যন, সেইবিলাকে কিন্তু আমাৰ ডায়েবেটিছ, এইবিলাকো আমাৰ আলজাইমাৰ্ছটো প্ৰক্ৰিয়াটো বেছি দ্ৰুত গতিত বাঢ়ি যোৱাত সহায় কৰে। গতিকে যিকোনো ধৰণৰ শাৰীৰিক অসুখ বা বহুত মানুহে চিগাৰেট খায়, ধোঁৱা খায় পেলাই তাৰ লাংছৰ হানি হৈছে, অক্সিজেনটো কমি যায় শৰীৰত, সেইটো কাৰণে আলজাইমাৰ্ছ ৰোগটো বাঢ়ি যোৱাৰ ভয় থাকে। গতিকে এনেকুৱা ধৰণৰ সমস্যাবিলাক আমি সমাধান কৰিব লাগে এটা সেইটো। আৰু
all right, these are some of the things. Of course, this will be beneficial for the caller who have just called. Thank you so much for calling. All right, doctor, we'll have more conversation, but we have to take a break.
Sure.
All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic Alzheimer's. Now, doctor, coming back to you again, we had an idea about what exactly is Alzheimer, which is the age group we see Alzheimer's to be affected. Now, if we talk about like when does it affect and why, what is the reason, doctor?
Okay, it's a very important question. The why? And the other part is that whether it can affect below 65, as I said, 65.
Yeah.
So earlier age is very uncommon. Is absolutely very uncommon. If it occurs in a very rare occasion, so if there is a memory impairment at an age earlier to 65, then we have to primarily look for other causes of dementia.
Okay.
So that is one. But very rarely, even Alzheimer's type of dementia, where we will see the plaques, the abnormal protein deposition in the brain, in some cases of dementia, which occur at the earlier age also.
Okay.
Now, why this occurs? And the fact is, the answer is till now people do not know. What happens in Alzheimer's brain that is known, but why that happens, what really triggers of that kind of an abnormal phenomena that is not yet known. The still research is going on.
So the reason is not yet known.
Not yet known. In fact, the research activities on Alzheimer's had started. A massive input of research funding has started only after US President Ronald Reagan was diagnosed with dementia, Alzheimer's.
Okay.
And so after that, a lot of research inputs. Now, good thing is that worldwide, number of institutes are working on treatment of Alzheimer's. So till now, we do not have any definite treatment. Now, the reason that we should be aware of Alzheimer's is because the sooner we start, management of Alzheimer's, I said management, the better the quality of life of the individual.
The sooner we diagnose.
As soon as we diagnose. So that is why people the society at large should be aware of it.
Okay.
Because as soon as they can feel that there is something is wrong with my father or mother, my grandfather, whatever, and then if we can take preventive measures. What kind of preventive measures? The certain medications we have now, which reduce the progression of the disease, who reduces the progression of the disease, but do not stop the progression of the disease. So till now, we do not have any definitive cure for the disease.
Okay.
The research is going on, some molecules are at the advanced stage of research, but till now we do not have. So that is why in the early phase, we can give certain medications.
So what are those early phase, doctor? What are those early symptoms while an attendant will come to know?
Right. The earliest symptom that might occur, if somebody shows an undue suspiciousness, like at home, I feel that people are trying to take away my belongings. People are talking and they might be talking about me, the suspiciousness.
Okay.
If it occurs for the first time in a person above the age of 60, 65, we should think about the probability of Alzheimer's.
If it continues for a
If it
good number
continues.
of days?
So, this could be earliest symptoms of Alzheimer's in some cases, not the memory impairment. Even if
Okay.
this problem might even start earlier to memory deficit.
Okay.
And after about 6 months of similar kind of problem, the person might show memory deficit. Or sometimes a depression occurring for the first time after the age of 60, 65, if it occurs, and which is quite uncommon, is not very uncommon, it might happen, but if it persists and do not respond to only antidepressant treatment, then it could be an early feature
yeah,
of
but
Alzheimer's.
a patient or a person, if it is showing a sign of depression suddenly,
For the first time
For the
in his
first
life,
time.
at the age of 65 or so, then it is probably early feature of dementia,
Okay.
Alzheimer's dementia. And then the next phase, he might show, that memory impairment, other kind of things. So what this person does when he becomes suspicious, he try to put everything together and keep everything with him. So all my belongings, so my bank passport, my ATM cards and everything, and then whatever belongings I have, I'll put I'll put them together and try to
Okay.
keep them, in front of me, so that people cannot steal those things. So these kind of things occur. So at this phase, there are medications which will prevent the deterioration of the disease to a certain extent. And at the next level, when the behavioral symptoms occur, say what kind of behavioral symptoms? Sudden aggressiveness, irritability, and then frustration, and not talking to people, this kind of behavioral changes, not being able to wear my clothes properly, not being able to button my shirt.
Okay.
So if these kind of features occur, some of them,
is there a changes
May-
in the food habits also?
the food
in the
habits
person?
per se do not
Suppose the
change.
person is loving something and trying to not taking up those things like he used to take in his early days.
So food habits per se do not change.
Okay.
What might change is that I might take my food and put it in my mouth and then do not swallow it for a long time.
Oh.
Or while taking the food, if I don't like the food, in that case, instead of saying that I am not liking this food, which people do normally, this man might become aggressive and irritable,
Okay.
and then throw the things away.
Okay. Okay.
So at times, family members find it difficult to understand why this my father or my mother or my grandfather is getting angry for no reason. I've given the food what he likes.
These are the changes in the behavior.
Exactly. So these are the behavioral changes. So what happens when the frustration comes? Instead of expressing it verbally, I express it with an emotional content or behavioral content. So when these kind of changes occur, they also can be helped
Okay.
with certain medications. But then, over and above, most important thing is that management of Alzheimer's problem is not a medical component only.
Okay.
So medical component is important, but along with that, the family members must also have the skills to manage.
Skills to manage the support which the
support
family
system,
members.
the social support system, it is important, very important.
Right. Right.
I think I'd like to add here that we have a Alzheimer's society. There's an Alzheimer's society in the world, the World
Okay.
Alzheimer's Society. Now, different countries have chapter. India has a chapter. Now, Guwahati also we have a chapter, Alzheimer's and Related Disorders Society of India, Guwahati chapter, which is started in 2012.
Okay.
We run a daycare center.
Daycare center.
We run a daycare center where people with Alzheimer's can come, stay during the daytime, where we have support staff, psychologists and physiotherapists, and where they can stay for the day and go back home in the afternoon.
Okay. That was my next question to you, doctor, actually,
Okay.
because we have seen now many households, both the husband and wife go for work,
Yes.
lifestyle has changed. So if there is a person who is suffering from dementia or Alzheimer's, so on that note, they find it difficult to manage things if they
Right.
keep a person or a nurse or anyone,
Yeah.
but they find it totally different for them. So on that note, how hospitals or how doctors help them on this, as you have mentioned about this daycare facility. So this is also very helpful for the parents, for the family members who have these kind of problems, isn't it, doctor?
Yes, the social support system is very
The social
important.
support
Social support
system.
is very important. And for that, even our society, we have imparted training, manpower training in different groups
Okay.
over the years. So we also have awareness programs.
Awareness program.
Recently, I had been to Dergaon, and then we had the discussion, and then we had a program there, awareness program. And a couple of years back, we had gone to Tezpur and had a program there.
Okay.
So we even in Guwahati, in different areas, we have this awareness program.
How is the response, doctor?
The response is, you see, when the people come to know about it, they ask questions. And then the awareness is being created. People are getting more and more aware. But I think a lot more can be done. We got calls from Lakhimpur also. People are getting interested there.
Okay.
So the people from Jorhat also inquired whether they can have. So definitely, people are getting more and more aware because there are people are living longer lives these days, and when they live a longer lives, the associated problems with old age also comes.
Okay, okay.
So one of the old age associated problem is that Alzheimer's. So this awareness support system is very important.
Very important. Proper counseling is very important.
The counseling is very important, and the family also must be, must be armed with the skills necessary to manage a person with Alzheimer's.
This is a big challenge for them as well, doctor. Now, how challenging is for the parents or the person's attendant out there at home? Because suppose if they find the early symptoms in the person and want him or her to take to a doctor, but they might not go, so it is going to be a challenge for them. So what is what ideas or what tips you would like to give to our viewers who are watching our show?
Okay. So if the person doesn't want to come to the hospital, it is absolutely fine. So even ours, we have created we have a website, and then we have a, what do you call it, an app.
An app, okay.
We have an app where people can go to that app and contact our our society, and
team
we
you
have home visits.
Home visits.
We have doctors who can go for a home visit. We have psychologists who can go for a home visit. So we have that.
Okay,
The name of the app is Samparka.
Okay, so this is going to be helpful for the ones who doesn't want to go to a doctor. Okay, doctor, we are really short of time. So what tips or what advice do you want to give to our viewers who are watching our show?
My advice is that for people who want to prevent Alzheimer's in their future life, start exercising, both physical exercises and mental exercises. Keep yourself active. If you are above the age of 55, 60, learn something new always, whether writing or learning a new music skills or whatever skills you learn computer something. If you want to learn tabla or harmonium or some activity, whatever you like, you do it, and this will keep you active, solve problems, and keep in touch with. Be socialized. Socialization is very important in preventing Alzheimer's.
Keep yourselves busy with whichever way you want.
And do not be, don't be a groaner and a moaner. সদায় যেটা আমাৰ মনত অশান্তি কৰি থাকে কিছুমান মানুহে যিমান অশান্তি কৰে সিমানে ৰিস্ক ফেক্টৰ বাঢ়ি যায় so keep yourself active, keep yourself happy, and then be happy.
All right. Thank you so much, doctor, for this lovely advice at this point in time, and I'm sure the viewers who have watched our show must be benefited with the conversation we had. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.